Welcome to Topic 3. Inflammation and Repair. In summary, inflammation is a response to anything that can cause tissue damage and more commonly to infection. It involves the blood vessels and the white blood cells. In the presence of an infectious organism or tissue damage, the body will release chemical mediators of inflammation, that will recruit and activate the white blood cells that move towards the area of where the infectious organism is, or where there is tissue damage. They will move from inside the blood vessel into the outside as the blood vessels dilate and increase their permeability. The increase in vascular permeability makes it easy for the white blood cells to migrate from inside of the blood vessel into the site of infection or tissue damage. The ultimate goal is to recognize the antigen, remove it and eliminate it. In inflammation we have the 5 cardinal signs of inflammation. In this slide only the 4 introduced by Celsius are shown. Rubor or redness. Calor or heat. Tumor or swelling. Dolor or pain. In this slide, the 5th cardinal sign, introduced later by Werkhof, is included. This is functiolasa or loss of function. When there is inflammation, one of the chemical mediators of inflammation, histamine, will be released. Histamine will cause the blood vessels, the arterioles, to dilate, leading to increase blood flow, the rubor. The increased in blood flow also contributes to the calor. The calor is also secondary to other inflammatory mediators. Histamine also increases vascular permeability, which leads to fluid from the intravascular space to go into the extravascular area and accumulate, leading to tumor. Because of the injury, the swelling, and the release of pain receptors, there is dolor. Lastly, depending on the location or severity of the injury and the pain, there will be loss of function.
These are the sequential steps of inflammation. Read through the next few slides as it presents details in the inflammatory process. These next slides presents the difference between chronic and acute inflammations. Based on what was presented so far, try to look at these histologic pictures and try to identify what is acute and what tissue is chronically inflamed.
Now let's talk about tissue repair. This is an important part of the inflammatory process. Once the offending agent or injury has been contained by the inflammatory process, tissue repair follows. Depending on the damage or injury and the type of tissue, the repair process would either lead to wound healing where there is little or no evidence of tissue injury, or it will lead to scar formation. Depending on the type of tissue, the cell's ability to regenerate or to repair itself will depend on these factors enumerated in this slide. Epidermal and bone marrow cells have the ability to regenerate and replace themselves. Neurons cannot grow back or regenerate. Liver cells, depending on the injury, could either undergo compensatory hyperplasia or develop scar tissue, as seen in liver cirrhosis. The next few slides will show you images of the abnormalities in tissue repair.